Welcome to our presentation on water fasting. Water fasting is a practice of only consuming water without eating or consuming other foods or beverages. It's gained recent popularity in research and social media, so we'll be breaking down how it affects people biologically and we'll discuss the benefits and risks of trying it out for yourself. We'll cover topics related to neural regulation and body weight, nutrition and immunity, and bioenergetics and metabolism. In the past few decades, obesity has become a dangerous epidemic. Around a third of United States adults are obese and 20% of United States children and adolescents are obese. To understand why obesity occurs, understanding the function of adipocytes is crucial. Adipocytes or lipocytes are your body's fat cells. Located in adipose tissue, they store energy as triglycerides. When you're in need of energy, those triglycerides get broken down into free fatty acids and glycerol so your liver can produce glucose. During constant caloric surplus, like in obesity, your adipocytes grow in size and multiply. Poor diets high in saturated and trans fats and processed foods in addition to sedentary lifestyles drive this process. Accumulation of visceral fat leads to chronic inflammation and can ultimately lead to atherosclerosis, increasing risk of stroke and fatal cardiac events. Your adipocytes also produce one of your body's key hormones, leptin. Leptin indicates your body's energy status. When released, it travels to your brain signaling to the hypothalamus that your body is sufficiently fueled. This signals you to stop eating and to enter a fat-burning, metabolically active state. In people who are obese, leptin is overproduced and the brain loses sensitivity to it. This leads to a chronic internal state of starvation, driving further eating and a state of metabolic inactivity. Water fasting may serve as a key treatment for conditions of obesity. Research has shown that water fasting leads to a 5 to 10% loss in total body weight, much of which is visceral fat. But what about leptin? Research has shown water fasting induces overall decreases in leptin levels, but more research is needed to test leptin insensitivity specifically. Water fasting also causes blood pressure to drop. Chronic hypertension, a hallmark symptom of obesity, causes a strain to your blood vessels and helps drive plaque formation. This drop in blood pressure due to water fasting might, therefore, be cardioprotective and prevent cardiac disease. When someone starts a water fast, blood sugar drops quickly, often by 20 to 40%, and the liver uses up its glycogen store. Once those run out, the body switches into ketosis and starts relying on fatty acids and ketone bodies for fuel instead of carbohydrates. Fasting also lowers insulin-like growth factor 1, or IGF-1, and slows the mechanistic target of rapamycin pathway, or the mTOR. Since these pathways usually promote growth, reducing them shifts the body toward repair. Together, these changes lower inflammation and help the immune system function in a more balanced, regulated way. As glucose levels fall during fasting, immune cells activate more slowly because they rely heavily on glucose for energy. Reduced activity in the mechanistic target of rapamycin pathway, insulin-like growth factor 1, and AKT also leads to fewer inflammatory signals. At the same time, FOXO, or fork-head boxo transcription factors, become more active, supporting cellular repair and stress resistance. Overall, these shifts help calm the immune system and reduce inflammation. Fasting isn't just an energy change, it alters how immune cells behave. When the body has less glucose and fewer growth signals during fasting, overactive immune cells don't have the fuel to stay highly activated. This may help reduce inflammation linked to autoimmune conditions. In simple terms, fasting limits the resources aggressive immune cells rely on. But results vary widely, and research is still developing. Some people may see improvements, while others may not, so fasting isn't a universal solution. In a fast, the body will go through major metabolic changes. As we stated before, in a fast, the body will start to rely on fatty acids and ketone bodies through lipid metabolism. This increase in lipid metabolism is important for those who want to lose weight. Along with this, the body uses amino acids for energy. But, to do this you must break down muscle. This is important to keep in mind when looking at weight loss from a water fast because about 2/3 of weight lost through water fasting is thought to be lean muscle. In addition, research shows that water fasting decreases LDLs, or low-density lipoproteins. By decreasing the amount of LDLs, we can decrease the risk of cardiometabolic diseases. This is because LDLs can build up on blood vessel walls, restricting blood flow and having potentially life-threatening implications. Although water fasting has many benefits, there are potential side effects. Studies have found that after water fasting there are increased triglycerides and HOMA-IR scores. This is interesting because high triglycerides are indicators of high fat in the blood. And an increased HOMA-IR score shows that insulin resistance went up. Whether water fasting is beneficial depends on someone's goals. It can offer short-term benefits like weight loss, lower inflammation, reduced blood glucose levels, and improved fat metabolism. However, there are trade-offs. About 2/3 of the weight lost comes from lean muscle, and fasting can temporarily increase insulin resistance and triglyceride levels. Fasting may also reduce autoimmune activity by limiting the fuel available to overactive immune cells. Overall, water fasting has both potential benefits and drawbacks, and its usefulness varies from person to person.